So there's two versions of a heel slide. There is a supine or laying down heel slide, and there's a seated heel slide. And both of these are important to help restore the bending of your knee. So you should have one of these blue nylon straps. If not, you can use a dog leash or a belt or even a towel. But to do a supine heel slide, you'll be lying down on your bed. You want to make sure that your foot is on a slippery sheet, or you can take like a plastic shopping bag over your shoe or foot to make it slide a little bit better. You're going to take that strap over your foot and you're going to slide your heel toward your bottom as far as you can go. When you feel like that's about all the stretch that you can tolerate, then come on back down. You're going to go nice and slow, maybe 10 to 15 repetitions. So just nice and slow, pull as far as you can, and then back on down. So you're not in a hurry, just get a nice stretch up and down. The seated version of a heel slide is you're going to sit in a chair, preferably with a floor that's tile or wood or something slippery, not a carpet. If you don't have that option, you can put a plastic bag over your foot again. But a seated heel slide is simply sliding your heel up under you as far as you can go and then back out. Okay? So the idea is we're putting a bend into the knee. You're going to slide forward or backward and then back forward again. Again, 10 to 15 times, nice and slow. Just work on that motion to get the bend back in the knee. So that's the seated heel slide and the supine heel slide. At least 2 to 3 times per day, 10 to 15 repetitions for each. There's 2 other exercises that are also very important. One is called happy feet or ankle pumps, and that is simply moving your foot up and down and around. And what that does is it helps to make the muscles in your lower leg contract, so it helps with swelling, but it also helps prevent a blood clot. There is no particular number as far as how many to do. You just want to move your foot up and down and around, and you can do that as often as you want during the day, but at least try to do it every couple hours. That's going to help prevent a blood clot. Okay, that's happy feet. The other exercise that's really important is a quad set. So your quads are the muscles on the front side of your thigh here, and sometimes they're a little sleepy after a surgery like this. So what you want to do is have your leg out in front of you, whether you're laying down or sitting, and you're just going to tighten this muscle right here, flex it, and then relax it. So you're tightening and relaxing your thigh. So you're just going to hold for a second or two and then relax. Again, maybe 10 to 15 times, just like that. Again, 2 to 3 times per day. One other exercise that's actually very helpful for getting your knee nice and straight is a hamstring stretch. So you can use this strap again. You're sitting on the edge of your seat. You can use that strap over your foot. You want to sit very tall. From your hip, lean forward just a little, and you're going to feel a stretch on the back side of your leg. So the strap just helps give a little bit of leverage. You're going to pull and lean into it, hold for maybe a 10 to 15 count, and then relax. Maybe 5 to 10 of those is plenty. So that's the hamstring stretch. As far as using a walker, we prefer a walker without wheels on it. The reason for that is because we like it to be more steady rather than mobile. Because after a surgery, you want the steadiness of a standard walker over a wheeled walker. So the proper height for a walker, if I'm standing good and tall and I let my arms hang down to my side, the handle here should be about where your watch band is. So for me, this is the proper height. We don't want it too low and then be leaning forward. We don't want it too high, so we're kind of off balance. But just a little bend in your elbow when you're holding onto the walker is proper. So about where your watch band is. Also, we like when you're walking to move your walker first, and then your surgery side, and then your good side. So walker, surgery, good side. So the safe way to go up and down steps is to go up with your good leg and down with your bad leg. We refer to the surgery side as the bad leg just for simplicity, but you're going to go up with your good leg. So let's say my right leg is my surgery leg. I'm going to go up with my good leg, and I'm going to come down with my bad leg. Okay. So what that does is it makes your stronger leg go up and down. It uses your strength of your good leg to lift and lower you. Make sure you've got a railing to hold on to, a handle of some sort, or a strong shoulder. We don't prefer to use a walker up on steps, so hold on to something sturdy, as in like a railing or a wall. But you're going to go up with your good leg and down with your bad leg.